Hi, my name is Taylor Spivey, and Molly, Makayla, and I's presentation is over cardiomyopathy. Cardiomyopathy is a heart muscle disease, and it can cause the heart to be less efficient in pumping blood, so it can lead to heart failure. There are different kinds of cardiomyopathy, but the main kinds we will talk about are restrictive, dilated, and hypertonic. Symptoms and signs of cardiomyopathy include when a person may have shortness of breath, fatigue, dizziness, fainting, abnormal heartbeats, and chest pains. Some sources say that patients with cardiomyopathy may even have swelling of the lower extremities and the stomach. However, it is common for patients to not show any symptoms of cardiomyopathy, so it is important to get tested in order to get a proper diagnosis. How is cardiomyopathy diagnosed? Apart from the symptoms, or if a patient has no symptoms, there are several different tests to perform in order to diagnose cardiomyopathy. A chest ray can be performed. It is useful in this diagnosis because it can show enlargement of the heart. Echocardiograms and electrocardiograms are also valuable tests. Echocardiograms can allow a doctor to see how the blood is flowing through the heart and if there is any obstruction with blood flow. Electrocardiograms can show heart rhythm and the electrical activity of the heart. If there are any problems with either of these tests, it could indicate that the patient has cardiomyopathy. Exercise stress tests are also useful for those who have problems with exercising due to cardiomyopathy. These tests show how the heart will respond to exercise and how well it can work during any physical activity.
There are three different kinds of cardiomyopathy: hypertrophic, restrictive, and dilated. These three kinds have similar symptoms and have similar effects on the body. Hypertrophic cardiomyopathy is probably the most common. It occurs when the heart muscle becomes enlarged. It can cause ventricular swelling, which causes blood flow to become less efficient, and the left ventricle can become stiff, which means the ventricle cannot become relaxed or fill properly. And because of this, there's less blood pumped to the rest of the body. There are also mitral valve changes occurring with this kind, and it doesn't work properly and can cause pressure to build up in the left ventricle. The thickening of the heart muscle commonly occurs at the septum, and because this thickening occurs at the septum, there can be restricted blood flow from the left ventricle to the aorta, and this makes it more difficult for the heart to pump blood to the rest of the body, and this can become hypertrophic obstructive cardiomyopathy. The next kind is restrictive cardiomyopathy, and it is less common, but it can quickly become dangerous. The ventricles become abnormally rigid, and scar tissue replaces the heart muscle. The ventricles cannot relax and fill with blood, causing the atriums to become enlarged. And important blood flow within the heart is reduced and can restrict blood flow to the rest of the body. And this can cause problems like heart failure, fluid buildup, and can cause arrhythmias. There are different causes of restrictive cardiomyopathy, including hemochromatosis, and this is a disease where there's too much iron formed in the body, and extra iron is harmful to different parts of the body, including the heart. Sarcoidosis is a disease that can cause scarring of the heart tissues, and this disease can cause inflammation of the heart and of other organs. Hypereosinophilic syndrome involves eosinophils, which we learned about in class, and these white blood cells build up over time in the heart and can cause inflammation of the heart muscle. Amyloidosis is a disease that can cause an unusual buildup of proteins within the heart. This is known as the most common cause of restrictive cardiomyopathy. The last kind is dilated cardiomyopathy, and this type of cardiomyopathy causes the ventricles to grow larger. Again, this can make it harder to pump blood to the rest of the body. A person with this condition may not show any symptoms other than shortness of breath and fatigue, which is often put off as another health condition. And it may be more difficult to figure out the cause of dilated cardiomyopathy, but a few common causes include complications of late stages in pregnancy, obesity, hemochromatosis, alcohol misuse, the use of certain cancer medications, and high blood pressure.
Hi, my name is Molly Fitzpatrick, and I am doing the treatment and prognosis for cardiomyopathy. So first of all, how cardiomyopathy is treated. There are plenty of treatment options to manage symptoms and to keep the condition from getting worse. So first of all, medications can improve the heart's ability to pump blood, lower blood pressure, slow heart rate, and lessen the chances of blood clots. The second treatment option is called a ventricular assist device, and this device can help pump blood from the ventricles of the heart to other parts of the body. And the final treatment option is surgery. So two types of surgeries include septomyectomy and a heart transplant. First of all, a septomyectomy is a type of surgery where a surgeon will remove a part of the thickened heart muscle wall that separates the ventricles. This surgery improves blood flow within the heart and lessens chances for mitral valve issues. The second type of surgery is a heart transplant. These transplants are options for cardiomyopathy. However, it does require waiting. So you'll be put on a list to receive the heart transplant, and this is only after other options are considered and will not work. And this is when the patient needs a new and healthy heart. The second thing I'll talk about is the prognosis of cardiomyopathy. So we know cardiomyopathy can lead to serious issues such as heart failure, but it can also lead to sudden cardiac death. How should someone live with cardiomyopathy? In order to prevent symptoms from getting worse, someone with cardiomyopathy would need to make some lifestyle changes. These lifestyle changes could involve having regular doctor's visits, a change in nutritional and exercise habits, and avoiding toxins in the body such as drugs and alcohol. And that wraps up our presentation for cardiomyopathy. Thank you.